Where's that Q&A button?
We're live.
Let's see, here we go. Here, this Q&A button over here?
Yeah.
Open Q&A. There we go.
Okay.
So,
We're live.
oh, thank you. Hi, everybody. Let's see, we have now some viewers going on right now. Okay. We're going to wait another minute as we have a few more people log in. Hope everyone's watching the game too. We have this and the USA game, soccer game, World Cup going on, so we'll make sure we give it, if you guys are watching this, we'll make sure we give you the score. I'm looking at my computer here while I'm looking at you guys over there. Oh, we already have all these. Where is the actual Q? John Anderson. Where is the actual Q&A? The actual Q&A is right here, John. Do I select it or what do I do? We already.
Yeah.
Do we select it or?
No, they'll just
Okay.
They'll keep coming in.
Okay.
It.
So should we start?
Yeah.
Okay. We can talk about botched later on, but first of all, welcome to our third?
Yeah, fourth.
Fourth? By the way, this is Chris. Chris helps me with all this. Say hi.
Hey, everybody.
That's Chris. So we're going to first start off with answering some questions, and we'll talk about, towards the end of this, we'll talk about botched, since I know that I have 1,000 questions about that wild TV show. The Wild Ride. Okay, so should I answer this one first?
Sure.
I think I did this wrong when I posted the question. Why do some people need nose work when they're getting dental implants? Or was that misinformation? By the way, love the show and can't wait to see more. And that's from Dee Hawkins. Thank you very much. Nasal implants, dental implants. Usually, dental implants have nothing to do with the rhinoplasty. Now you got all these questions I just popped in. So I don't know where that came from. So I think that might be misinformation. Sometimes they're putting in dental implants, it can get in your sinuses and cause chronic sinus infections. So you have to be careful of that. Okay? Am I going to there or am I going here? Hi, Dr. Nassif. You ever worked on the Kardashians? First of all, you guys know I can't answer questions about other patients. But no. How would I get to possibly be on your TV show? Okay. Oh, how do I get more of these? Like, how do I scroll down? Where?
There's a scroll tab. Oh, that's all that's there right now.
Okay. Good question. There's an email address, so let me do this now. For anyone who wants to submit themselves to the TV show, this has nothing to do with me. So calling my office or anything is not going to help. But we do have an email for you. Do you know what the email is?
Oh, yeah.
And yes, I'm drinking some decaf Cafe Americano. So, while he's looking for that, I'm going to answer a few more questions. That's about the show. And Kathy asked, where do I log in? I think you just log in right here, young lady. You just got to log in the Google Hangout under my name. Is that how they log in?
Yeah.
Okay. Okay. By the way, about botched, there's something called After the After Show. And if you guys go to realself.com, which is a huge website, talks about beauty, I think it's on the homepage there. So the first 2 episodes of After the After Show, basically, is on there. So, okay, Tracy. Surgeries are so multifaceted. I watched botched and saw you removing rib, slicing cartilage, and I think even harvested skin from the scalp. How difficult is it for you to make a plan like that? Is it years of experience that pull you to do this? Do you consult with other doctors to brainstorm for ideas? I would never guess a nose job could be so complicated. Tracy, good question. So it's rib cartilage, not the bone. So the rib, first part of the rib, as you come underneath through here, is made out of cartilage, and then as you go down, it's in a bone. So we take a piece of cartilage, and the reason why we do that is because when I'm reconstructing a nose, all this is made out of cartilage. Like I have rib inside my nose. It's all made out of cartilage. And if they've already used the cartilage from inside the nose, called the septum, then we don't have enough of that to use. The ears we can use here, but it's a little bit too soft. So the last alternative I have is rib. The tissue saw, fascia, especially if I'm making an implant to place over the bridge, rather than using just a big piece of cartilage or an implant, which is not natural material, it's a foreign body, I will take tissue, which is called fascia, which lies right on top of this muscle here, called the temporalis fascia, and then I'll take the cartilage, we'll chop it into small pieces, then we can wrap it up. As a matter of fact, there's a full ethnic rhinoplasty video. Where is it? It's on my YouTube channel, Dr. Paul Nassif. And where else is it? On the website?
There's links from the website. You can find it there.
Where? In the video section? Go to the video section of my website, Spalding Plastic Surgery or Rhinoplasty Specialist. You can see that. But no, I don't consult with other doctors. I've been doing this for a while. I mean, I'm a revision rhinoplasty specialist, so I usually don't need advice. If there's some kind of a weird, extremely complicated case, if for maybe once every 5 years I might ask an opinion and throw it around my colleagues, but it's pretty rare.
Here's that email.
Okay, it's the email to be on the show is botched@evolutionusa.com. evolutionusa.com. Plus we have a lot more questions. Okay. I'll answer that in a minute. Okay, so there was an ophthalmologist question, Colabomo. I don't honestly answer those types of questions, but the shape of the eye, so the shape of the eye can look different, but it can be open a little bit. You might have something called ptosis. And I don't do ptosis repairs of the lower eye or the upper eyes. That's when the upper eyelid is usually getting a little sleepy. And that's something, a friend of mine who does that, a guy named Guy Masry. And he's in Beverly Hills. He fixes things like that. I don't. I'm sorry about that. We're also doing live tweeting during this. Are they doing that now? Mm-hmm. Deborah, I have my septorhinoplasty in February this year. Okay, so you're still healing. I've done turbinoplasty as well, but recently my nose started to block either side and I can't breathe properly. So it's a most likely relapse. Okay, so I can't really give information. And by the way, all the questions I'm going to answer is just general information. I can't really be specific to each one. I have to kind of do that when we are doing these kind of Google Hangouts. But I can say that you need to go see your doctor. Let them examine you, because if it's switching from side to side, that's normal. It's called the nasal cycle. But you got to make sure you're not collapsing anywhere or other things like that happening. So I'd really recommend you seeing your other doctor, the one that did the surgery. I'm going to skip from here and go over to here real quick. Breast surgery. I'm sorry, Karen. I don't do that. As you know, I'm a facial plastic surgeon, so I only work from here up. Obviously, you can call Dr. Terry DeBro. He'll do it. Oh, Jennifer. Hi, little Jennifer from Real Self. I've already told everybody to go watch After the After. Okay, it is a little too much of it. She's making fun. She's making fun of my V-neck. All right. Okay, I'll pull it up now. She made fun of me. Jennifer made fun of my V-neck. Jennifer's cool. So, by the way, that's an incredible website. It's especially incredible because I'm on the cover of it, on the front page of it. How much is it to do a septum surgery? How much is it to do a rhinoplasty? So prices are something that I don't get into. However, Chris, overall, a full rhinoplasty with just a general first time with operating room anesthesia, surgery center, what does that range? Do you know?
10 to 15, 12 to 15.
Probably about 12, yeah. 12 to 15,000. Plus, I have another associate, Dr. Don Yu, who's a little bit less expensive than me. He was my fellow 3 years ago, and so if we're looking for something less, it's probably him. So that's probably the average. I'm guessing probably closer to 13 to 15 for me, for a regular rhinoplasty, and that's everything. I received Botox for my migraines 12 weeks ago, and I just received my second dose last Monday. Does not seem to be helping. You know, I don't do a lot of the migraine Botox injections. I've done them before. Some people I know it's helped, some it hasn't. So I assume you went to a neurologist, and that would probably be the best person to get some help from. But I have to tell you, it also depends on the amounts and the location. Beyond your show, I've already told you about that, Karen. And okay, let's go back. So botched@evolutionsusa.com. That's the email about being on the show. Okay, Janine said, first of all, she complimented, saying that she has a lot of respect for me. Thank you. I work for the IRB at NYU. I deal with experts in plastic surgery. I protect patients from any harm done in research. There have been such promising, exciting strides being made in research. We actually do research. So you're asking, do we do research? And have there been any procedures you have declined because of a frivolous request? Yes. So we do research. I have my fellows. We're probably in the process of doing 4 or 5 studies right now. One's on using 5-fluorouracil in the nose. Oh, that thing is making too much noise. One is on doing putting fine nice cartilage in the nose. We have like 5 or 6 studies going on. Revision, rhinoplasty, all kinds of things. And if someone has a frivolous request, basically not frivolous, but they're not realistic, or there's some issues like that, then we turn down those patients, especially if they're not healthy, they're unrealistic, or they have BDD, body dysmorphic disorder. So about 10% of our patients get turned down. And by the way, I'm glad you're addicted. I appreciate it. To our new show, Botched. Okay, chronic migraines which lead to sinus problems, infections, diagnosed with cysts, steroids, and meds don't help. Cosmetic nasal surgery will not help chronic sinus problems. First, you have to get a CT scan, and then you basically have to have, you can do cosmetic nasal work at the same time as the sinus work. For example, I'll usually have one of my ENT guys do the sinus work while I'm doing the cosmetic rhinoplasty or the functional rhinoplasty for breathing. But in general, I have to tell you that if it's that bad, you may need sinus surgery. And they'll take out the little cysts and the polyps and all those things in the nose. It's usually done at the same time. It's usually not that big of a deal. That was from Daisy. Okay, so you just simply. What do I love most about my job? Christina. Simply McSteamy? That's funny. That's a cute name. What I like most about my job, it's fun. It's fun that when you're actually in the middle of surgery and you're really reconstructing something that's really, really difficult, that's fun, number one. Number two, or probably more importantly, when you actually help someone that's been bothering them all their life. Yes, you get satisfaction of doing a facelift or taking some skin off the upper eyes, but if someone has been traumatized by something, whether it's a horrible scar, a nose they've been teased all their life, or some type of trauma on their face, or something that's reconstructed that they had all their life and it's been devastating them, and you fix it, and the patients are appreciative, and then when they see their look at the first time, about what's happened. As a matter of fact, make sure you look next week's Botched. You'll kind of see a little bit of that. Thanks for that question. How are we doing here? Okay. Those are all live tweets too. Recovery time for a deviated septum, and that's from Gladys Skincare. It's usually not that long. If it's just the septum, you can do it on a Friday and go back to work on Monday. Usually there's no packing inside the nose. Are you enjoying the World Cup? I am, but unfortunately I'm not watching a lot of it. But I would like to know. Actually, I'm going to have you guys, whoever's out there, I'm looking at the side here, either tweet it or tell us what's going on with the score of the game. Is there anything about your own rhinoplasty result from your 4th rhinoplasty that you weren't happy with? First of all, I think my nose is great, but even with me, when it comes to 3-dimensional healing and shrink wrappage of the nose, you still get some unevenness of the nostrils, one side's lower than the other. I still have a little bit of nasal obstruction. One side's going in more than the other, but that's normal healing. And so I have to tell you, that's always going to happen. So I might even need a little tweak. But I will tell you, the more surgeries you do, the more these little issues can happen. And I love my nose. Okay. Okay. What advice do you have for aspiring doctors? Make sure you're not doing it for the money. Make sure you're ready to work your butt off. It's different nowadays. I think the training is a little bit easier now than it was back when I did it in the old days. Just work your butt off, and you got to really love this before you get into it because you're dedicating your whole life. And I did, let's see, 4 years of medical school, 5 years of residency, 1 year of fellowship. So you got to put all that time in. How do I go about finding someone to use a laser to revise a horrific scar from a botched surgery 15 years ago? Most doctors, most dermatologists, most plastic surgeons have lasers. Whether it's our office or someone else's office, they all have lasers. So you can, most of the time they'll do that. So you can, just call the office or something. By the way, our office number is 310-275-2467. 2 websites, rhinoplastyspecialist.com. Actually, and for more blogs, drpaulnassif.com, right, Chris? Mm-hmm. And then spaldingplasticsurgery.com. Spalding without the U. Should I keep going here? These are Facebook questions here. Yeah. Okay. Cindy, she's 66 with sagging eyelids. What kind of surgery would I need to bring them up? I know that would help me in seeing better by having them held up. Thank you for taking the time to answer. It's a very, very nice question. First, we have to look at your eyebrows to see if the eyebrows need to be pulled up simultaneously with moving skin from the upper eyelid. Brow lift, maybe. Upper blepharoplasty, making incision in your crease, taking out some of the skin, not overdoing it so you don't get hollow looking. It's very important. In addition, if you have a problem with your vision, sometimes doing a visual fields exam, and some doctors might take insurance, and the insurance may help pay for the surgery. Okay, so we're cool here, Chris. Mm-hmm. Removal of facial moles. Paulina. So I don't do that. My dermatologist partner, Dr. David Amron, does that. And usually what they'll do is they'll shave them, and they're really good at shaving them all. But if it needs to be cut out completely, then I would do that. But remember, when you take off anything, you always will have a little scar. Sometimes you can laser them off. I have huge bags underneath my eyes, and this is from Jane. My dad had them, and so does my brother. What treatment is there for this? So if it's just fat, pseudo-herniated fat in the lower eyelid, we make an incision underneath the eyes. This is the surgical way. Non-surgical, I don't really know if there is a good non-surgical. I don't remove the fat, because if you remove the fat, unless there's just too much, you can have hollowness underneath here. So I do something called fat repositioning. I take the fat here, make it into a pedicle, slide it into the hollow area. So basically it gets rid of the fullness, but it also prevents hollowness. And I have videos of fat repositioning on YouTube, on my website, under the video section. How are we doing over there? Good. Margie. I use results. Okay, so I like to soften my eyes. So if there's some softening that needs to be done underneath your eyes, such as fine lines, here you can do Botox or Dysport or Zeman. Here you can have an intense pulse light. You can have a peel. You could have a little stronger non-fractionated or fractionated CO2. So those are all non-surgical ways, but they're all a little bit invasive. I have, oh, by the way, everybody, I have great skincare coming out. It's called Nassif MD, and my skincare line should be up. I'm working 2 years on this with all kinds of detoxifying agents and antioxidants. We're talking hopefully in the next 2 months, so keep your eyes out for Nassif MD. I have a exfoliant, an AM, and a PM. Okay, is that one? Mm-hmm. Oh. How many years does it take for someone to be a surgeon, plastic surgeon, and how do you deal financially while studying family? Ooh, good question. To do your residency and fellowship, if you do, I'm a facial plastic surgeon, so medical school 4 years, residency 5 or 6, fellowship 1 if you go my route. I worked a little bit, that's a difficult thing. You have to try to get loans. So dealing with the financial aspects that's a real headache, and that's where you have to see if you can get loans to help you. Okay. Let's see here.
0-0.
It's halftime. Halftime.
0-0.
0-0. 0-0. No score yet. Let's see. Angie. Other than rib cartilage, what else can you use to rebuild the nose? Amazed by your skill reshaping the cartilage. Thank you, Angie. Septal cartilage inside your nose, as long as there's enough. Ear cartilage, which is a little bit too soft, but it's good for camouflage. Then rib. That's all I use. I don't like using foreign implants in the nose. Jasper, most taxing procedure you've ever done? Probably, 2 taxing things are if I'm doing what we call a full face rejuvenation. From here all the way down, that takes me a long time. That's taxing. Doing a full, hard, destroyed nose, where I'm completely reconstructing it after pretty much someone's almost lost it, that's very taxing. Michelle, what is the most fun part of you in filming botch? I'd say it's hard work. It's like 4 or 5 months of filming, and you're working your butt off filming, and it's tiring. Goodness. Fun, hanging out with my buddy Terry and letting him rag on me and letting him enjoy himself ragging on me. Roy, how did your interest in plastic surgery begin? Good question. Before I answer that, do me a favor. Tell Janet about our lovely patient that, probably about 15. By the way, Terry DeBro. Hold on, watch this, everybody. I can't talk. I'm right in the middle of a Google Hangout, and everyone's watching me talk to you. Do you want me to say hi? Do you want to say hi if I put you on speaker? But no smart-ass comments. Wait, hold on. Go ahead. Talk.
Hi, this is Dr. Teddy Star of Blocks with his assistant, Paul.
I'm taking him off. He's off. You've lost it. Anyway, can I call you back? Okay, just call me. All right, I'll talk to you later. All right, bye-bye. Did you all like that? My goofball colleague. He is very funny. I got to tell you that. I did. He is very, very funny. He's a little bit more goofier than me. I'm a little bit more serious, obviously, when you watch the show. He's our comic relief. So I let him enjoy himself and tease me. Especially, when you're like him, he's insecure about himself, so he has to tease me, I'm going to tell you that, Terry, when I call you later. You're going to love that. Anyway, interest in plastic surgery. Long time ago, I think I started wanting to be a plastic surgeon. Let's see, when? God. I was doing my head and neck residency. I watched a nose job, and I was already in the middle of my residency. I thought I was going to go into ear skull-based surgery, which means dealing with ear, behind the ear, into the brain, working with neurosurgeons to remove tumors that involve the nerve of the ear going all the way back to the skull inside the brain, and the brainstem. I love that. Very technical, very detailed. But somehow I started doing, during my residency, I ended up getting a private practice. I had patients come to me as a resident in Albuquerque, New Mexico that wanted plastic surgery. So I started doing it. So I started having my own practice as a resident, and then I just went into facial plastic surgery, did my fellowship in St. Louis with a doctor named Dr. Regan Thomas, my hero. Great, great doctor. Okay. Okay, actually it's going this way. These are coming in, Chris, and getting mixed up. Here's one. Pieces of rib. Okay. First-time rhinoplasty. You haven't seen me do a first-time rhinoplasty yet. The only time I use rib for the first-time rhinoplasty is if I'm doing a major ethnic rhinoplasty, whether it's an Asian or African American usually, because the septum, the cartilage inside is very small, and I need strong cartilage to build up the nose and the ears too soft. So if I'm building up a complete dorsum, building up the complete tip, reconstructing someone's nose to give it more of a ethnic, okay, then that's when I will use rib. It's not that common. Wait, 5 minutes?
Mm-hmm.
5 minutes left, everybody. Mary, Des Moines, Iowa. My mom and dad spent a good amount of time at Des Moines. Well, these are a lot of questions, Chris. Jeepers. Best filler to use for laugh lines, smile lines, you can use any of them. Restylane, Juvederm, Bellatero, Perlane, any of those. Juvederm, let's see. All those, I probably would use Juvederm Ultra Plus, or you can even use Radius, which is you can't get rid of it like the hyaluronic acids where you can dissolve it instantaneously, or Perlane. Christine, Miami, Florida. I had my lip augmentation with Restylane. My lips are swollen. Should I go see my injector? It's normal for your lips to be swollen. Give it another 2 more days. If not, go see your injector. But it's normal. Use a lot of ice. Marcy, Portland, Oregon. So a lot of these questions are about their other doctors. And so I really don't want to answer questions about procedures that you guys have had with your other doctors. I'd rather have you just talk to your doctors because it's probably, those doctors would appreciate she or he would appreciate if you spoke to them directly and called their office. Because since I don't know everything that you had done, I don't want to give you, the wrong advice. I need filler for the lines between my brows. What would be the best filler to use? And that's Jason from Waltham, Mass. No fillers. Botox, Xeomin, Dysport only. There's been reports of putting fillers in here and gently occluding one of the blood vessels and killing all the skin. No fillers, Jason. What am I doing, these or these? Or am I doing something up here? Okay, we've already... Uh-oh, here we go. This is our little friend, Jennifer. We are dying to know if the Dubrobats... Oh, we gotta use that. Yeah. You bet. Jennifer, tell my ladies to use Dubromance to continue to grow and blossom this season.
That's good.
You are funny. That's Jennifer from Real South. And yes, he's a great guy. We've been friends for 15 years. And I have to tell you, even on emails, this teasing still occurs. Even when we're in New York on an airplane, the teasing still occurs. It's just nonstop. So, but I tease him differently. I just don't tease him in public in front of millions of people. Plus, my teasing is actually real, though. I'm usually insulting because it's warranted. No, but he's a great guy. I'm teasing. He's a great guy. Female celebs, including one that was featured on the last Botched. Face look very puffy and just like jelly. What type of filler? What is her faces? Maybe too much filler. It could be anything. It could be any filler. But if you overdo the filler, it won't look good. So the bottom line is conservative filler. That's Kathy. Using Dasha, asked about doing RF treatments, galvanic, after having Botox, microcurrent. I honestly don't know since I don't do any of that. I think you can do Botox after having fillers. But, yeah, we do that all the time. Facials. One more? Okay. I have one more question to answer. How did you get your skin so clear? Oh, I like that. And the person who asked me that is Chaco, so she's the one interviewing me on Real Self. Actually, that's no makeup. Maybe I'm shiny here. My skin is glowing because of my skincare product, Nassif MD. We'll give that a little while before I get it out. We're just working on the bottling right now, or the packaging. Let's see. Hold on one second. Looking, see if there's anything, because I really want to... Oh, my God, am I late? John, you are late, my friend, but come to the next one. When is the next one, Chris?
About a month from now.
Probably a month from now, but we'll post it. Okay. So, I think, and I have a lot more questions, but we'll have to do it some other time. And, what?
Episode 3.
Episode 3? Oh, Botched. Episode 3, Botched. I did notice, by the way, that on the East Coast, It's on at 7 p.m. in the East Coast. But I also noticed that on my DirecTV in the West Coast, it was on at 9 p.m. But on a regular TV, it's on at 10 p.m. on Pacific Standard Time. The next one is a great show. You have to watch it. See some of the coming attractions. And it's following the Kardashians on Sunday nights. And let me see if there's anything that's simple. Okay. Desiree asked about that excess eyelid skin. And Desiree, you might have too much skin there, so if you have a lot of skin like this, you won't be able to see your eyelid. So sometimes you need something called an upper eyelid lift or a blepharoplasty. Same thing, one of my eyelids is partially closed, and that's Mitchell. So that depends if there's excess skin causing the eyelid to fall, or if there's something called ptosis. Ptosis is where the actual eyelid gets droopy. And that's something that some plastic surgeons do, some don't. An oculoplastic surgeon may fix that. Anyway, folks, you guys have a great day. Finish watching the soccer game. Rhinoplasty specialists, spaldingplasticsurgery.com, also realself.com, great website, and Dr. Dubrow, God bless him if he's watching this, which he probably isn't. He's too busy probably tweeting or looking at himself, doing something like that. I think that's about it. I'm going to say goodbye and thank you all, and we'll let you know when the next Google Hangout is. All right, bye-bye.